Physical activity is important for people of all ages. For our presentation, we'll be specifically talking about how physical activity benefits older adults and ways for them to remain active.
28% of older adults reported no physical activity outside of work in the past month, and this only continues to increase with age. In Illinois, 35% of older adults are obese, and in the United States overall, Americans that live in the West, Midwest, and Northeast tend to be more active than those living in the South. Women are also more inactive compared to men, with 25.5% of men being inactive and 29.4% of women. As education levels decrease, inactivity levels also increase, which is most likely associated with poverty, limiting access to education and capabilities to make necessary changes to benefit health. However, 4 out of the 5 of the most costly chronic conditions can be prevented and managed with physical activity, including heart disease, diabetes, asthma, or joint pain. The reason many older adults aren't active enough is due to mobility impairments. The majority of older adults report mild to moderate mobility impairment, and 28.3% of this group suffers from severe functional impairments.
Physical activity can have many benefits. Engaging in consistent physical activity can reduce anxiety and stress. Routine exercise can boost energy levels. Physical appearance is positively affected with routine exercise, and engaging in physical activity makes people feel better because they see good results and usually don't get sick as often. As a whole, physical activity can aid in both mental and physical health. People that exercise regularly have a decreased chance of heart disease, depression, type 2 diabetes, a stroke, and numerous cancers. It is even more vital for adults to get exercise compared to children because they are more susceptible to chronic diseases. With that being said, around 80% of diseases can be prevented from ever occurring or at least delayed with routine exercise. Regular exercise also aids in good aging, everyday actions, and even leads to people living longer.
Based on the benefits they can receive from physical activity in order to continue living healthy in the last few decades of their life, near or at the age of retirement, older adults will want to relax and spend time with family and not worry about dealing with and paying for treatments on chronic illnesses, showing them that it only takes a little time each week to receive health-related benefits and reduce risk of poor health and will be the most effective message.
The recommended amount of exercise per week is 150 minutes of moderate intensity aerobic physical exercise, so enough to raise your heart rate or break a sweat, or instead, at least 75 minutes of vigorous intensity aerobic physical activity throughout the week. On top of this, it is also suggested that older adults perform muscle strengthening activities involving major muscle groups on 2 or more days per week. If you have any disabilities or poor mobility, still try to stay as active as you can. Choose activities that you enjoy, or look for ways to stay active throughout your day. Staying active is one of the most important things you can do to be healthy, and is something that people should especially remember to do as they grow older.